This video is dedicated to the millions of kids who will be doomed to an early, painful, and needless death when they make the decision to smoke. In video 2, we review the case histories of each patient seen briefly in video 1, their disease, and how smoking caused it.
Surgeon General's warning: smoking causes mouth cancer, throat cancer, lung cancer.
Don't wait. Still 7 hours away.
That was Mr. Willie Thornton trying to speak after his tongue was removed. After years of smoking, he noticed an enlarging growth on the back of his tongue which interfered with swallowing and breathing. A biopsy of the growth proved that it was cancer. To remove the cancer, which was blocking his airway, most of his tongue had to be removed and a surgical hole placed in his neck to allow him to breathe. The surgical hole in his neck is called a tracheostomy and is seen here. Despite surgical treatment, the cancer spread to Mr. Thornton's neck, as seen here. He received radiation treatment for these cancerous lumps in his neck, but died anyway shortly thereafter.
Look what happened to me. It could happen to you.
This patient had a cancer of the mouth which spread up into his nose, sinuses, and eye. In order to remove this cancer, half of his face had to be removed surgically. His wife pointed to his face and said,
"Up there, that's where the cancer is coming back. And that's caused from cigarettes."
Amazingly, the patient could still speak, and when asked, "Did you think you could quit anytime you want?" he answered,
"Yeah, I thought it could, but you can't."
This is a patient with cancer of the lip from smoking. You can see the cancer progressively invading his lip and face. This is Mr. Jerome Brown. After years of smoking, he noticed a change in his voice and increasing hoarseness. This led to a laryngoscopy. In this procedure, a slender tube with a light at the end, called a laryngoscope, seen here, is passed through the nose and into the throat to the level of the vocal cords. Normal vocal cords, as seen through the laryngoscope, are shown here. Inspection of Mr. Brown's vocal cords revealed a large whitish cancer as seen on the right. To remove this cancer, Mr. Brown's entire larynx or voice box containing his vocal cords had to be surgically removed. This operation is called a laryngectomy. As Mr. Brown's doctor stated,
he is now 1 week out from surgery, and you can see that he now has his windpipe brought right out to the skin. As a tracheostomy. He will breathe through this hole in his neck for the rest of his life.
This was necessary because the airway between his mouth and his windpipe has been surgically closed off to prevent him from choking when he swallows food or fluids, something the larynx, which was removed, normally prevents.
He will be able to eat and drink fairly normally, but he will never be able to speak or use his voice in a normal fashion.
Although he can't speak, Mr. Brown wrote a handwritten message for teenagers which reads, "Think, don't smoke." This is Mr. Gregorio Flores. He also developed cancer of the larynx from smoking and required a tracheostomy, a surgically placed breathing hole in his neck. Despite this surgery, he continued to smoke. He inhales the smoke through his mouth and then blows it out through the hole in his neck. Because of his severe addiction to nicotine, he continued to smoke this way right up until his death. He died from inoperable, widespread throat cancer a few months after appearing in this video. At the age of 32, Mr. Calvin Dorset also developed cancer of the larynx from smoking, which required a laryngectomy, a surgical removal of the voice box, and a tracheostomy, a surgically placed hole in his neck. Following the surgery, he also couldn't speak, but eventually trained himself to speak by using an electronic device, which, as you can see, he places in his mouth. Speaking through this device, he said,
I was diagnosed with cancer of the larynx. I had a tracheotomy performed, and at that time, I quit smoking. Don't go through what I went through. The easiest way to avoid what I'm going through is not to smoke at all.
This is Mr. Claude Levy.
I've developed a tumor on top of my lung, and it seems that it came out of my lung. And it's in a spot that is very dangerous because they can't see it too well. And I should be operated on it. But right now it's a lung problem that I have.
After years of smoking and feeling well, Mr. Levy suddenly coughed up streaks of blood. This led his doctor to get a chest x-ray which showed a large cancer in his right upper lung. And this is the cancer, the white, rounded mass the size of a small baseball. This led to a bronchoscopy. During a bronchoscopy, a slender tube with a small light at the end of it, called a bronchoscope, seen here, is passed through the nose all the way down to the lungs where the cancer can be seen and biopsied. Here you see Mr. Levy undergoing a bronchoscopy. The bronchoscope is being passed through his nose into his lower throat to the level of the vocal cords. Then, through the vocal cords, into the windpipe or trachea, and then down to the right and left main bronchi, which lead to the right and left lungs. At this level, you can see a large cancer which is bleeding and almost completely plugging the right main bronchus. Here you see a biopsy forceps pinching off a piece of the cancer to prove the diagnosis. The diagnosis of lung cancer was proven, but by this time the cancer had spread and couldn't be removed by surgery. Mr. Levy therefore received treatment with radiation in an attempt to burn away the cancer, and chemotherapy in an attempt to poison the cancer with drugs. These treatments failed to control his cancer and also caused many toxic side effects, including total hair loss and recurrent nausea and vomiting. He died shortly thereafter. At autopsy, Mr. Levy's lungs looked like this. They were stained black from cigarette tars, and a large whitish cancer was seen in the upper lung field. A few weeks before he died, Mr. Levy asked if he could leave a message for kids who have started to smoke.
I started smoking when I was about 15 years old. A friend of mine gave me a couple cigarettes, and that's how it all started. It's very hard to quit. I suppose we get addicted to the nicotine, and there's some psychological involvement also in it, so it's very, very hard to quit. If you did start, do your utmost to start now, because later on it's going to be extremely hard to do.
How did smoking cause the mouth, throat, and lung cancers of these patients? 1. Harmful chemicals in tobacco smoke repeatedly damage cells in the mouth, throat, and lungs. 2. In time, a few damaged cells reprogram their DNA and genetically mutate to cancer cells. 3. Unlike normal cells, cancer cells grow without control, invading and destroying more and more surrounding tissue. 4. Cancer cells can also break away from the original tumor and travel through the body to form new tumors in distant sites, such as the brain, bone, and liver. This is called metastasis.
Surgeon General's warning: smoking causes emphysema.
This is Mr. Taj Breadwell receiving oxygen by face mask.
I do have emphysema, which comes from smoking. I found it extremely hard to stop to where it became almost impossible. How far I can walk without getting shortness of breath? About 15 to 20 feet. Now I have to be on oxygen all the time.
This is Mr. Richard Heath, receiving oxygen by nasal prongs.
It all started with smoking a cigarette when I was 12 years old. If I walk 10 or 15 feet, I'm out of breath. If I walk from my chair in the living room to the toilet in my bathroom, in my bedroom, it's maybe 20, 25 feet. Steps, 25 steps. And then I'm really exhausted. And talking makes me out of breath too. Everything makes me out of breath. You don't last very long without lungs.
After years of smoking, both of these men developed progressive shortness of breath to the point that just walking a few steps or just speaking a few sentences got them severely short of breath. The lung function tests, breathing tests, of Mr. Heath and Mr. Bredwell looked like the markedly abnormal one seen on the right. A normal test in a non-smoker is shown on the left for comparison. As you can see, airflow during breathing is markedly reduced in smokers with emphysema because the airflow is severely obstructed. The chest x-ray of Mr. Heath and Mr. Bredwell looked like the one on the right, in which the lungs are greatly overexpanded and about twice the size of the normal lungs shown on the left. Why are the lungs of these men so hyperinflated? Why is their breathing so obstructed? And how did smoking cause this? Harmful chemicals in inhaled tobacco smoke cause inflammation, which damages the air sacs of the lung. Air sacs lose their elasticity and their walls rupture. Air that flows into them can't flow out easily and becomes trapped. The end result is large air spaces filled with trapped, stagnant air which cannot be exhaled. You can see how overexpanded Mr. Bredwell's chest is in order to contain his overinflated lungs. You can see how labored his breathing is, even at rest. He breathes rapidly and utilizes his rib muscles and his neck muscles to pull in enough air. A person with severe emphysema is frequently panicked, just trying to get enough oxygen to survive. Before they died, both men wanted to leave a message for kids.
My message to younger children is to not start smoking because it's not cool at all, and you won't have to worry about stopping.
I would advise young people to be smarter than I was, and stronger and braver than I was. Because had I been smart enough, I wouldn't have started. And that's the way you need to think.
Surgeon General's warning: smoking causes chronic bronchitis.
I was choking on my own air.
This is Mr. Harold Mulhauser. After years of smoking, he developed a persistent smoker's cough, which produced increasing amounts of thick mucus. These are the symptoms of chronic bronchitis, which is defined clinically as a chronic cough which produces mucus for at least 3 months per year for at least 2 years. This is very common and occurs in 75% of regular smokers. How does smoking cause these symptoms? Harmful chemicals in tobacco smoke cause chronic inflammation in the large airways, which are called the bronchial tubes. This leads to a marked increase in the size and number of mucus glands in the bronchial wall. The large number of mucus glands secrete a large amount of mucus into the airway, which must be coughed up to prevent drowning in your own secretions. Because of trouble clearing these secretions, Mr. Mulhauser required a tracheostomy, a surgically placed hole in his neck through which the excessive mucus could be suctioned out. Mr. Mulhauser's bronchus looks like the one in the bottom panel, which contains about 10 times the number of mucus glands compared to the normal bronchus of the non-smoker shown in the top panel. Mr. Mulhauser's message?
I never thought this would happen to me, just like people with cancer. I'm not going to get this stuff. By golly, if one of you stops, just one out of this mess, it'd be worth it.
Surgeon General's warning: smoking causes heart disease.
This is Mr. Jerome Brown. After years of smoking, he developed pressure-like chest pain which radiated down his left arm and occurred each time he walked a few blocks. His doctor suspected that the chest pain originated in his heart and ordered a coronary angiogram. A coronary angiogram is an X-ray which shows the blood supply to the heart. A normal coronary angiogram is shown on the left. Mr. Brown's coronary angiogram looked like the one on the right and showed a critically blocked coronary artery, seen at the arrow. How did smoking cause this problem, and how did it cause Mr. Brown's chest pain? 1. Harmful chemicals in tobacco smoke damage the lining of arteries so that less blood gets to the heart, as shown at the arrow. 2. Smoking adds carbon monoxide to the blood, which reduces the oxygen supply to the heart. 3. Smoking makes the heart work harder by making it beat faster and against a higher blood pressure. When Mr. Brown's heart was forced to work harder while receiving less blood and less oxygen because of his smoking, his heart became damaged and produced his chest pain. Despite medication, Mr. Brown's chest pain became more severe, more frequent, occurring even at rest, and required coronary bypass surgery for relief. During the coronary bypass surgery, Mr. Brown's chest was surgically opened, his heart was exposed, and the blocked coronary artery was bypassed with a vein taken from his leg. This increased the blood and oxygen supply to his heart muscle, and fortunately relieved his chest pain. Unfortunately, smoking also decreased the supply of blood and oxygen to Mr. Brown's feet by causing peripheral vascular disease. This resulted in gangrene in several of his toes that had to be amputated. So this poor man had 3 very serious illnesses, all of which came from smoking. 1. Cancer of the larynx, which required a laryngectomy and tracheostomy, as seen in the upper panel. 2. Blockage of the blood and oxygen supply to his heart, which caused angina pectoris, heart pain, and required coronary bypass, open heart surgery, middle panel. And 3. Blockage of the blood and oxygen supply to his feet, causing gangrene of his toes, which required amputation, lower panel. All of this could have been avoided if Jerome Brown never lit that first cigarette. As his physician stated,
He's been through a lot and is still hanging in there, but you don't want to be put in this position.
Surgeon General's warning: smoking may complicate pregnancy.
this baby was born premature, weighed only 2 pounds at birth, and was in acute respiratory distress. This baby's death may well have been avoided if the mother hadn't smoked during her pregnancy. The baby inside of a pregnant woman who smokes receives all of the poisons from the cigarettes, including carbon monoxide. This causes prematurity and respiratory defects, as seen here.
My name is Willie Mae. I started smoking at the age of 15. I became pregnant at the age of 15. I smoked during my pregnancy. My baby was born with asthma, respiratory breathing problems, and he's very sick.
My name is Valerie. I started smoking at the age of 13. I had previous miscarriages. I don't know if it's from the smoking. I have a small premature baby that did make it. He had breathing problems. He breathed like he has asthma. He was born at 2 pounds and 4 ounces. He was a very small baby, which they tells you on this pack of cigarettes it can cause premature babies from smoking or even death. And so far it is true.
Warning: smoking ages the face, and smoking stains the teeth and hands.
In this slide, facial photographs of non-smokers are compared with those of regular smokers of the same age. The smokers on the right can be easily picked out because their faces are much more wrinkled. Smokers' face has been well described in the medical literature. Smokers in the 40 to 49-year age group were as likely to prominently wrinkle as non-smokers who were 20 years older. Tobacco tars stain your teeth and hands black, as seen here. In the same way, but much worse because the smoke is inhaled, tobacco tars stain your lungs black. In this slide, the lungs of a smoker are compared to the lungs of a non-smoker. These are casts of real specimens. The lungs of the non-smoker have a normal pink color, left panel. As you can see, the lungs of the smoker are stained black from inhaling the tars and tobacco smoke, middle panel. These are the very same black, oily tobacco tars that cause cancer, chronic bronchitis, and emphysema, as seen in the far right panel. This is a normal cleansing tissue. It represents clean lungs. In this experiment, smoke from a single Marlboro cigarette was blown forcefully through this tissue. Even though the cigarette had a filter, you can see how much tar got through to stain the tissue brownish black. This large amount of stain came from only one filter-tipped cigarette. Imagine how black your lungs get after smoking hundreds of cigarettes. If you're thinking about smoking, try this experiment and see for yourself.
What problems does smoking cause teenagers?
At first, I enjoyed smoking. I loved the feeling of, you know, I'm cool, I'm a man. But it's not like that. I wake up and I can't help myself but to smoke. I've tried quitting many times. It hurts to stop. Okay. I'm addicted. I used to trick myself and say, you know, hey, I'll never get addicted. All my friends, no, I'll never get addicted. But just like that, the more you trick yourself, the worse it's going to be. It's embarrassing, actually, to me, to have to, you know, depend on a cigarette. You know, I have to have one. I have to have one. It's very embarrassing for me. When I'm with people that don't smoke, I feel like, you know, I have to separate myself from the group in order to have a cigarette. And it's just, it's like I said, it's embarrassing. A lot of girls do not like the smell of cigarettes, do not enjoy, you know, being around people that smoke.
Jay Taylor is a 19-year-old smoker who started smoking when he was 16 years of age. After only 3 years of smoking, pulmonary function testing of his small airways at the University of Miami Medical Center revealed that he already has the lungs of a 66-year-old non-smoking man. Jay already has difficulty participating in competitive sports with his current lung function. If he continues to smoke, he's clearly heading towards disabling emphysema and chronic bronchitis with shortness of breath at rest and the need for continuous oxygen.
Every time I light up a cigarette, I think about, you know, maybe in 30 years, you know, I'm gonna, you know, die of lung cancer, you know, have a tube in my throat, and it scares me, and I still smoke.
You still smoke?
That's what scares me the most.
For smoking cessation information and/or information on referral to a smoking cessation clinic in your area, call 1-800-4-CANCER or call the American Lung Association, Heart Association, or Cancer Society. Cancer is a growth that invades tissue without control and has a tendency to spread to new sites. Emphysema is a pulmonary condition characterized by overdistension and destruction of the air sacs in the lungs. Chronic bronchitis is prolonged inflammation of the bronchi characterized by attacks of coughing up mucus. Coronary heart disease is a condition, such as arteriosclerosis or hardening of the arteries, that reduces the blood flow through the coronary arteries to the heart muscle. All of this suffering and early death could have been avoided if these people never lit that first cigarette.